Hello and welcome to the Learn Psychology series. In today's video, we are going to dive deep into therapeutic approaches, specifically focusing on behavioral techniques and their significance in modifying behavior. Understanding these techniques is crucial as they are widely applied in therapy to help individuals overcome various psychological challenges. So, let's get started. Behavioral techniques. In therapy, a wide range of techniques are available for changing behavior. The primary aim of these techniques is to reduce the arousal level of the client and alter behavior through classical or operant conditioning, with different reinforcements. Vicarious learning procedures are also used if necessary. Negative reinforcement. This technique focuses on responses that help individuals avoid or escape from painful stimuli, providing them with negative reinforcement. For instance, when it gets cold, one learns to put on woolen clothes or use heaters to avoid the discomfort of cold weather. Negative reinforcement helps us move away from dangerous stimuli as well. Aversive conditioning. In aversive conditioning, undesired responses are repeatedly associated with unpleasant consequences. A common example is when an alcoholic is given a mild electric shock while smelling alcohol. Over time, the association between the smell and the shock makes alcohol aversive, helping the person give it up. Positive reinforcement. In contrast, positive reinforcement is used when adaptive behavior is rare. By reinforcing such behaviors, they are encouraged to occur more often. For example, if a child is not consistent with doing homework, the mother can reinforce the behavior by preparing the child's favorite dish when homework is completed on time. This increases the likelihood of the child doing the homework regularly. Token economy. This is a technique used for individuals with behavioral problems. Every time the desired behavior occurs, a token is given as a reward. These tokens can later be exchanged for a treat or reward, such as an outing or special privilege. This system is known as a token economy. Managing wanted and unwanted behavior. Differential reinforcement can help reduce unwanted behavior while increasing desired behavior simultaneously. One method involves using positive reinforcement for wanted behavior and negative reinforcement for unwanted behavior. Another method is to positively reinforce the wanted behavior and ignore the unwanted behavior entirely. Example. For example, let's take the case of a girl who cries when she isn't taken to the cinema. The parents are instructed to only take her if she asks politely and not when she cries. By ignoring her sulking and reinforcing the polite asking, the unwanted crying behavior decreases while the polite request behavior increases. Phobias. Phobias are irrational fears related to specific objects, people, or situations. They may develop gradually or stem from generalized anxiety disorders. Phobias are typically grouped into three main types: specific phobias, social phobias, and agoraphobia. Specific phobias. Specific phobias are the most commonly occurring type of phobia. These include irrational fears, such as an intense fear of animals or enclosed spaces. Systematic desensitization, WOLPI, hierarchy. Systematic desensitization, introduced by WOLPI, is used for treating phobias. First, the client is interviewed to identify fear-provoking situations, and together with the therapist, a hierarchy of anxiety-provoking stimuli is prepared. Starting from the least anxiety-inducing situation, the therapist guides the client through relaxation exercises while imagining these situations. Over time, the client is able to manage progressively more anxiety-inducing scenarios while remaining relaxed. The principle of reciprocal inhibition in phobia treatment. The principle of reciprocal inhibition states that two opposing forces cannot coexist at the same time. This means that relaxation inhibits anxiety. By focusing on relaxation, the client is able to overcome the anxiety, allowing them to tolerate greater levels of anxiety with continued relaxation. Albert Bandura. Social learning theory, social cognitive theory. Bandura introduced the concept of observational learning, where individuals learn by watching others. Modeling refers to imitating the behavior of a model, and vicarious reinforcement occurs when we observe the consequences of another's behavior, influencing our own learning. Modeling processes. Modeling is a technique where the client learns new behaviors by observing a role model, usually the therapist. Vicarious learning, or learning by observing others, is employed here. Gradually, through small rewards and reinforcement, the client acquires the desired behavior. We will discuss more on cognitive therapy in the next video. I hope you understood today's topic on therapeutic approaches. Thank you for watching, and see you in the next one.